All right, hi everyone. As of today, April 11th, Kansas has 1,268 positives statewide. That is up by over 100 since yesterday. Kansas also has reported 293 hospitalizations with 55 deaths. Riley County is still at 20 positives. We haven't seen an increase in positives in the last few days. And out of those positives, 7 are recovered. We do have 12 tests that are pending, and we've had a total of 137 negative tests so far in the county. Please note that just because we haven't seen our numbers increase in the last few days here in the county, we are still seeing a significant increase statewide. So please stay the course and continue to stay home. If you have any questions regarding COVID-19, please don't hesitate to email us at rileycountycovid19@gmail.com. We check that every day. On the weekends, we might be a little slower in our response, but have some patience and we'll get back to you as soon as we can. If you are experiencing any symptoms, please call our screening line at 785-323-6400. We have healthcare professionals that answer those calls every day, even on the weekends, from 8 a.m. until 10 p.m. Again, that number is 785-323-6400. We are accepting mask donations at Westview Community Church. You can drop off those cloth masks anytime from the hours of 11 a.m. until 3 p.m. on Monday, Wednesday, or Friday, starting next week, or on Saturday, anytime from 9 a.m. until noon. That's also a distribution point, so if you're looking for cloth mask, you can pick up during those hours. For more information, you can visit the Westview Community Church Facebook page or the Riley County Health Department Facebook page. If you'll be in a situation where social distancing is hard to maintain, according to CDC guidance, it is recommended you wear a cloth mask. That is to protect others from you. We thank you for all your support. We're very grateful for that and for following the guidance that's been handed down to you. Thank you for keeping your community safe. We wish you a happy Easter, and I'll take any questions at this time.
Hi, this is Vivian Uccello from the city of Manhattan. Just wondered, do any of the members of the media have questions for Julie today?
Yes, this is Becky Goff with WIBW. Julie, you mentioned Westview Community Church is collecting masks. Last I'd heard, they have received only 60, and their requests to receive masks from the community greatly outnumber that. Is that correct?
Yes, and that's why we highly encourage the community to donate more masks if you can.
And Julie, can you talk about who might be eligible to pick up masks that are donated?
Really anyone. Right now, Westview is limiting 3 masks per family just because we don't have that many donations. But really anyone that wants a mask, that needs one, you can pick this up. According to CDC guidance, it does recommend that individuals, if you're not able to practice that social distancing, to wear a mask. So if you're going to be in a place with a large amount of people, like a grocery store, it might be a good idea to wear a mask. And again, that's to protect others from you. You may be carrying the virus, but not be experiencing any symptoms, but you're still contagious. So it's a good idea to wear a mask in those situations. But please remember that that doesn't make other public health methods thrown out the window. Please continue to practice your social distancing. Make sure that you're disinfecting surfaces and make sure that you're practicing hand hygiene. Just because you're wearing that mask doesn't mean that everything else should be thrown out the window. So please continue to practice those good public health methods.
And Julie, this is Vivian Uccello again. We've had a few questions on the Facebook page asking about the wearing of masks for essential workers. Now, it's my understanding that this is a suggestion, this is not a requirement. Can you speak to that a little bit if people ABC essential workers who aren't wearing a mask or gloves?
Right. So at this time, it is a recommendation. It's a strong recommendation of ours and of CDC to wear a mask if you're not able to maintain that social distance of 6 feet. So if you're going to be in close contact with individuals on a daily basis, or in a situation where you're going to be in close contact with people, it is a good idea to wear a mask.
Thank you so much for providing some clarity on that. Do we have any other questions from the media at this time?
This is Haley Dixon with the Manhattan Mercury. Julie, I have a question about lab testing rates. For Riley County, it's 2.38 per 1,000 people. Do you know why the rate is low? And do you have any concerns about the amount of undetected cases? Thank you.
Sure, it's a good question, Haley. Not real certain as to why that is low at this time. It could be that we're just not seeing as many people that need to be tested. I do want to reiterate kind of our flow of how that happens. If you have symptoms, for instance, cough, shortness of breath, fever, you need to call our screening line. That's the 785-323-6400. That's your first step. From there, the nurse will ask you a series of questions, and then they will decide whether you need to call your primary care provider. If you don't, they might ask that you call KSTAT. But your second phone call then, if the nurse directs you to do that, would be to call somebody, a primary care provider, and they will further evaluate you. Upon that evaluation, if they decide that you do need to be tested, they will send your information over to our swabbing station, which we run every weekday in the afternoon, and you can be swabbed there. So that's the method. So like I said, I'm not sure as to why those numbers are a little bit lower. It kind of ebbs and flows, but we'll see what next week brings for us. As I've mentioned before, Dr. Lee Norman did say that this week that we just finished and next week are going to be two of our worst weeks. So far, we haven't really seen that in the county, but we could see it next week. And that is why it is so important for people to continue to stay at home. I've been seeing some things on Facebook recently of, people are getting anxious and wanting to get out, and maybe thinking that since this is kind of a low time for us right now, that that's a good idea for them to go ahead and get out. And I know with Easter upon us tomorrow, people might want to get out and see their family and friends, and that's not a good idea at this time. We want you to stay inside, adhere to the governor's order. We are not out of the woods yet.
Thank you so much, Julie. One more question about testing. Is it just the Riley County Health Department that is conducting swabbing right now, or are private physicians still doing testing? Right.
Yeah, it's not just at the health department. Private physicians are definitely doing it too.
We had another question on the Facebook page about this idea of flattening the curve. We've heard that nationally, we've said it locally. How do we know when and if that has been accomplished? What are we looking at to make that determination?
I think we're still monitoring that. We've done pretty well so far. We saw that we had one of the highest grades as far as social distancing grades and movement, that our movement is lower than some of the other counties. So that's good. We're headed in the right direction, but I think it's too early to tell now if we've been successful. I think we're doing well. We just need to continue doing what we're doing.
Excellent. Thank you so much. Do we have any other questions from the media? Okay, I'm going to check in with the Facebook page one more time to see if anything else has come in. This is also about testing. Julie, do you know if we have access to those 45-minute tests that Dr. Lee Norman has been talking about, or have those yet to be rolled out?
Those have yet to be rolled out, but we'll definitely let you know as soon as we do.
Excellent. Do you have any final thoughts for the public today?
Going into Easter, I just want to wish everyone a happy Easter, and I hope you all have a great day, but please remember to stay inside. If you need to Zoom or Facebook Live, definitely do that, but please try to adhere to the governor's order that's still in place. We need to stay inside so that we can get out of this sooner rather than later. And thank you all for your support.
Thank you. Thank you for being here, Julie, and for all the work that you've been doing to keep the community safe. We will not have a live broadcast tomorrow, Easter Sunday, but we'll be back on Monday at 4:15. If you have questions in the meantime, please don't hesitate to reach out. We'll do our best to answer those for you. And again, we encourage you to stay home, enjoy a nice Easter with your family. And I've heard most, if not all, of the local churches are offering virtual services for tomorrow for people who have options to worship safely. But happy Easter, thanks again, and we will see you on Monday.